The way to think about the Delta variant is that I keep on thinking of it as a hurricane. It comes in and it leaves immunity in its wake. What does that mean? Well, it comes in fast in places without high vaccination rates like India, which had a 4% vaccination rate when the cases with Delta started going up in early March. Were devastated. And that is what happens without vaccination. There was a lot of suffering and there was a lot of death, and it was terrible. In the UK, because of high rates of vaccination, the cases went up fast because that's what Delta does. It gets everywhere. It's very transmissible. But luckily, the hospitalizations became decoupled from cases. They were nowhere near following the path of going up like cases went up, like hospitalizations went up prior to vaccinations. So the country did open, actually, and cases started plummeting. That's because those of us who are vaccinated may see a little Delta. We're trying not to, but that actually strengthens our immune response. But those who are unvaccinated, very unluckily, some people get sick and some people get immunity from it. And that brought down the cases. That's what Delta is doing.
And we know that there is a lag between cases, hospitalizations, and mortality, usually a couple of weeks on each. A state like California, 820%, where you are, 820% jump in the 7-day average case counts since July 2nd. Most populous state in the United States. But thankfully, hospitalizations are down 77% from their peaks. Do you think that number may tick higher over the next couple of weeks, or do you believe the higher vax rates will keep that number, hopefully, lower?
I believe the latter. I think those higher vaccination rates will keep the hospitalizations lower, just like they did in the UK, just like they did in Israel, and just like they're not doing, like you just said, in places of low vaccination, like Arkansas is our prime example here in the United States. In areas of high vaccination, even though the cases are going up, we have protected our vulnerable, and we have also protected anyone who's been vaccinated from severe disease, which is why we're seeing so much less of the hospitalizations following the cases. Like you said, 77% down. We have to get through this time.
And very quickly, Dr. Gandhi, are we underestimating, as Scott Gottlieb has said, natural immunity? We talk about vaccinations, but are we also underestimating the benefit of natural immunity?
You know, I think the natural immunity definitely gets us through a pandemic as well. I mean, we definitely didn't want it this way, but yes, there are a lot of people who've been infected in this country, and that also is associated with low rates of reinfection. Natural immunity and vaccination both, putting those together is what gets us through a pandemic.